Good afternoon. Welcome back to the Oneida Nation here in Wisconsin. We're on Oneida Live, and today is Tuesday, September 9th, 2025. So, on this fine sunny day, we have a guest from Oneida Behavioral Health with us. I'm Bobby Webster. I'm the PR director for the Oneida Nation. Today, we're going to talk about some of the services, some of the programs, and some of the things that are happening in Oneida Behavioral Health. So Mary Kreischier is here. She's the director of Oneida Behavioral Health. She's got a lot of information, so pay attention, grab your notebook, grab your pencil. You might want to jot some of this down. All right, Mary, tell us what's going on.
Thank you, Bobby. Good afternoon. So we're going to start out with providing some of the feasibility study results that were completed for the Transitional Residential Detox Treatment Facility. So, and when we start going through this, there's going to be a lot of information that I'm going to be sharing with our partners who completed the feasibility study, which was Wipfli, who did the market assessment, financial analysis, feasibility study services, and then DSGW Architects are the vendor that worked with us on creating what an layout of a facility might look like. So the perspective changes everything. This is the Wipfli executive summary that was given to us of the results of the feasibility study. So what they looked at, behavioral health is part of the comprehensive health division, and we provide a lot of robust behavioral health services to the community. And some of the services that they looked at were the mental health and substance abuse counseling services, same-day counseling services, mental health counseling, intensive outpatient therapy, addiction recovery coaching, medication-assisted treatment, harm reduction services, and the community Narcan training. And they looked at particularly the services that are provided on or near the reservation. So behavioral health currently refers out for detox, residential treatment, transitional housing as part of the service offerings that we currently provide. We partner with 19 other organizations when we are needing to refer out community members to services for either detox, residential treatment, or transitional housing. The top challenges reported by the Oneida community members and the behavioral health staff were challenges in navigating treatment options. Most treatment programs have a wait list resulting in delays. People need to leave the Oneida community to access treatment. Most programs lack culturally sensitive treatment options. Behavioral Health engaged in Wipfli and the DSGW architects to develop the feasibility to understand the impact of the Oneida Nation expanding its services offerings to include transitional, residential, and detox treatment. Some of the things that they looked at was community feedback. They had listening sessions and they had a community survey. Looked at the market demand on the need for services based on the population. The facility need, looking at the requirements and the construction costs, and the financial impact, what costs would be incurred by Oneida Nation. From that, from their assessments, the percentage of survey respondents who indicated that each service is significantly needed in the community, the detox services was about 34%, the transitional treatment services was about 55%, and the residential treatment services was about 63%. From that response from the survey, we had them rank each service on between 1, 2, and 3, the first, second, and third priority. And from the feedback that we received, the blue on this slide is their first priority, the orange is their second priority, and the green is their third priority. And detox services was about 59%. The residential treatment services was 55%, and the transitional treatment services was about 30%. So the residential and transitional services are feasible based on the community need. However, these services would likely operate at a financial loss. So the detox treatment is it's not feasible. It's determined not by the feasible given lack of resources, staffing, and community need. The residential treatment, it is feasible. However, the cost would be about $7.4 million for beds, about 20 beds, 10 male, 10 female, and operating costs per year would be about $1.45 million. The transitional housing is also seen as being feasible with the bed need of 5 beds with capacity to expand. Operating costs per year about 480 to 490 million. The facility cost 2.74 to 3.58 million. So those are the results of the feasibility study. Information that we had requested to be able to provide us more information on how we move forward with expanding services through Oneida Behavioral Health. So the what's next? We have 2 projects that are kind of pending right now. The CDC approval packages, which are being completed to be requesting some funding, and that is the residential treatment facility and a package for the transitional living facility. More to come on that information. So some of the questions that we get asked quite often is, how do you access substance abuse treatment services? And the first thing that you can do to access substance abuse treatment services is through same-day substance abuse care. Just walk in. Just come in and see us. Monday through Friday, as long as you're there before 10:30 a.m., you'll have a substance abuse counselor greeting you to complete your assessment to get you started on your treatment journey. Now, part of that process is there's always paperwork. But you check in at the front desk. They will help you out with getting some of the intake paperwork, which is information like completing HIPAA forms, completing informed consents, things like that. You'll meet with the triage counselor who will assess your initial needs, assessing if you are there for same-day substance abuse care or if you're there for a mental health need. And if you're determined that you're there for the same-day substance abuse care, they will get you scheduled with a counselor to be seen on that same day. And when the counselor meets with you, there's a couple of things that they go through, which you can expect to be there at least about 90 minutes, so plan for it. But what they go through is they have to complete, which is a level of care assessment, which is the ASAM criteria. I know acronyms, right? A lot of acronyms. But what it means is Addiction Society of Addiction Medicine. It's a patient placement criteria. So that's where we always shorten it up to say level of care. And really what that is to determine is if you are meeting that level of care where you need to go into a detox facility where we're looking at acute intoxication or withdrawal potential. We're also looking at the health history and other physical symptoms that might be going on for you, any kind of mental health or cognitive conditions that might be going on, anything substance use related. So we'll be asking a lot of questions about risky behavior, how much you're using, how is it affecting those around you, getting more information around that, and then asking about your recovery environment. Who do you have around you that can support you while you are getting help? Why does it matter? Why do we even look at levels of care? It's really about providing treatment to individuals to meet their individual needs. Not everybody needs the same type of treatment. So we do look at several different ways in providing treatment. And when we look at the level of care, if you're meeting some of that symptomology where you need to be getting detoxed, we do have a process for detox that we coordinate. So, which I had already said, first thing you need to do is just walk in, show up. And you could call if you are feeling that you're having symptoms. You don't need to come to behavioral health if you're feeling that you need detox services. You can just go to one of the local hospitals and be sure to let PRC know that you are being admitted. So if you come in the same day, you're going to meet with the triage counselor. They're going to coordinate some care by checking on what's available for the individual, depending if they're purchase referred care eligible, PRC, or if you have insurance, or what type of detox it is that you might be needing. Or you can consult with your primary care provider. So what is alcohol and drug detox? This question also comes up too, because everybody's a little bit different, but some of the symptomology is the same. So when an individual is consistently or repeatedly using a substance, it is likely that they will develop a physical dependence over time. Physical dependence is the body's natural adaptation to the presence of the drug, and once it is significantly established, the body requires that drug to function as normal. When somebody is dependent on substances and they abruptly discontinue, or dramatically reduce use, that's when withdrawal symptoms are likely to emerge, which you may see some of that when people start getting the sweats or starting to shake. It may be because they have been starting to withdraw from a drug or a substance. For opioid use disorder, we have, oh, just wait, I missed a slide. We'll slow down for just a second. So the requirements to receive detox from behavioral health, we really don't have many requirements. It's just really showing up, and then we have to do either the Clinical Institute Withdrawal Assessment, which is an alcohol withdrawal scale, or we do the opiate, which is a COWS. They call it COWS. It's a clinical opiate withdrawal scale. Those are required for us to ensure we're talking the same language with the other hospitals or treatment services that we are referring to. And then the other part of that is ensuring funding. We want people to get help. We don't want you to be sitting with a bill that you can't pay when you are working towards your recovery. So we have to look at what type, if you have insurance or don't have insurance, and we look at the purchase referred care, or PRC, because PRC is what funds for detox. So we do need to make sure that you keep your information updated and current with purchase referred care. Within 3 days of being admitted, we do need to let them notify. So if you go to get detox without coming to behavioral health, which you can do, please be sure to be notifying PRC that you were admitted and that all of your updated information is completed with PRC. Otherwise, they will not be able to assist you. So there's your plug-in for PRC. The next slide is really just going kind of where can you go for detox. So it's just a couple of the different places that we use. Bellin Health is now changing to Amplify, but I put both of them on there. We have the two local hospitals, St. Mary's, St. Vincent's. Ascension is St. Elizabeth's in Outagamie County, Brown County Treatment Center, and then we have, which I'm going to talk about in just a couple of seconds, is the medication-assisted treatment. But those facilities that we use for opioid use withdrawal is either going to starting the medication-assisted treatment with our providers at the health center, or comprehensive community treatment centers, or Clean Slate are the other two options that we have for people that are needing to withdraw from opiate use disorder. So that's where I'm going into the next slide, is really about the medication-assisted treatment. What is that? What does that really mean? Suboxone or buprenorphine, most people know it as Suboxone. It is provided to an individual who is starting to go in withdrawal from opiate use disorder. It has to be started when you're in active withdrawal. So it is one of those medications that we have started providing inductions at our Oneida Community Health Center. And it is something that you can continue to see your provider and do on an outpatient basis. We also have naltrexone, which is Vivitrol. It's an injection, or it can be given in an oral tab. But Vivitrol is also used for alcohol. It blocks that euphoric or effects, the effects of cravings, the craving effects. And those both can be, Vivitrol can be prescribed by any one of our providers, either psychiatrist or the primary care providers. And we do provide it at the health center where we schedule with nurse-only appointment to get the injection. And then there's methadone, which is something that we refer over to comprehensive community treatment. They are the methadone clinic in our local area. And that it's a long-time treatment modality that's been out there to help reduce opioid cravings, withdrawal, blocks the effects of opiates. It is something that has been used for quite some time, and we do refer over to the Comprehensive Community Treatment Center. So why use it? What's the goal of MAT? It really helps improve the birth outcomes among women who are pregnant and continuing to use, decreases the withdrawal and cravings, decreases use and risky behaviors. It helps people gain and maintain employment who are in early recovery, and it helps improve the treatment retention. Bottom line, it helps save lives. It's, that's what we're here for, is to help save lives. So how do you access MAT? I kind of went through some of this, but just to reiterate, we are collaborating with the Community Health Center, our own Oneida Community Health Center. We have some providers that are providing, doing the Suboxone inductions or doing the Vivitrol injections. You can talk to your behavioral health provider or discuss it with your primary care provider. We coordinate schedules with the health center to get the induction process started. If there is, for some reason, that you're not sure that you want to use Oneida Community Health Center, we do have the alternatives of going to the Green Bay Comprehensive Community Treatment Center, also known as the Methadone Clinic, or Clean Slate, which is over on Allied in Green Bay. The other services that we provide in helping individuals with substance abuse and mental health, but that we're kind of focusing on substance abuse today and the different levels of care. It could be that when you come in and get assessed that you're meeting that lowest level of care, which would mean attending or participating in individual counseling. We have 7 substance abuse counselors, and we have 5 co-occurring therapists who can provide the substance abuse specific services. Also with that, if you're meeting that lower level of care, we do have Insights group, which is an 8-week educational group. So this could be for the folks out there that are dabbling a little bit in using some substances, might be getting in a little bit of trouble, maybe at work, not showing up, or not attending school. It's a psychoeducation group. It's really about providing some education so you can make better choices in how you are looking at yourself with dabbling in substance use. Another group that we do have is the Transformations ATODA, Alcohol, Tobacco, and Other Drug Abuse, Dialectical Behavioral Therapy. That's what DBT means. That is a 12-week psychoeducational group that will help build skills to promote recovery and build life worth living. The 4 focuses on that group is the mindfulness, the distress tolerance, emotional regulation, and interpersonal effectiveness. This group is 1 day a week on Mondays from 9:30 to 11:30. It is one of the groups that when you get your assessment completed, they may be, your provider might be recommending that you attend the Transformations group, or it can be recommended after you start doing individual sessions and you're finding out that you might need more than just attending individual sessions, or you've been through treatment times before, that this is just another way to gain some skills to keep you or work towards recovery. The additional group that we have, this is when you're getting to that a little bit higher level of care, which is the intensive outpatient treatment, which is our discovery group, which it's 9 hours a week, Tuesday, Wednesday, Thursday, 3 to 6. This is really, group time is really individualized. It could be a minimum of 18 sessions. There are some assignments and stuff that you'll be completing, but it really is the amount of time that you're spending in working towards your recovery that is important here. When you're looking at level of care and it's suggesting that you need that higher level of care, it's focusing on how do we get you in programming where we can engage you into recovery support, applying some of the skills that you're learning in that group so you can be in recovery. And then once you complete that, we do have aftercare group, which is on Wednesdays from 5 to 8. And this is really about long-term recovery. You can be in that group, they say minimum about 16 sessions, but this is really about practicing your recovery with still getting the continued support. We're not just leaving you out there on your own. So yeah, when you start adding all of this stuff up, you can be in treatment 6 months to a year. And that is without even leaving home. If you have the right recovery support or right environment, you can do this without going into a residential or an inpatient facility. And saying that, however, if you're still struggling a bit and you're while you're doing this through outpatient treatment, that is when we look at referring you into a residential treatment facility. And that is where you're getting the 24/7 individualized intensive structured care. You're there for a minimum of 30 days. And it is about really taking a time out for you to slow down, get some structure in your recovery program, look at how having a treatment plan in place for how are you going to maintain this once that 30 days is over, in which usually when you are getting done with that 30 days of residential treatment, that's when you're coming back to behavioral health and you're doing a step-down program where you're going into intensive outpatient groups and then into the aftercare group. And the next slide is just a few different treatment centers that we are partnering with. I'm not going to name them all. I think there's 15 or 16 on here. We keep adding different treatment centers that might be available and helping our people. We have, the issue is sometimes is that we have the waiting list, so that's why we have so many different partners that we work with, because when people need it, they need it now. We can't be waiting too long. The other program that kind of like is over encompassing within behavioral health is we have the Substance Abuse Health Home Pilot Project, which Oneida Nation was one of 3 that got accepted for this Medicaid pilot project. It's about providing wraparound services to individuals who are using substances. So, and it really includes everything for the patient around mental health. It includes the cultural consulting. It includes, how are we integrating this individual back into the recovery support and having an overall transitional plan and follow-up. It's continuous care. They're having contact with somebody multiple times a week. And then for our recovery support. So recovery support and peer support is really important for individuals to get that continued support while they're working their recovery plan. The recovery coach supports the recovery in many different ways. It's really about identifying common recovery concerns and barriers, providing support tools needed, expanding on the recovery strength. It's looking at their talents and how do they continue to be successful in recovery. There's several support groups and things on our website that you can go to check out and participate in. And if you haven't, if some of you didn't attend the Gunio event on August 29th, we had a wonderful fashion show from our recoveries that participated, and that was all part of the support groups that they were working in at the Recovery Nest. It was really something to see. Very, very proud of those in recovery that are doing the work. They're doing the work, and it is happening in Oneida. It is happening. We have a lot of people in recovery in Oneida, and we need to find ways to celebrate them. And then one of the last things is the harm reduction pieces that we have within behavioral health. We are doing the Narcan training. We have it available to anybody in the community, different programs, departments that are needing the training. You don't need to be a patient of behavioral health to receive the Narcan kits. So if you're not at any of the community events and you feel like you need a kit, stop in. We have plenty of people that can get you that information, but they are available to anybody that is needing it for themselves, a family member, loved one. That's part of the idea is that we want everyone to carry Narcan, whether you need it or not. We don't know when we come across people that may be maybe overdosing, and we might need to use the Narcan. We've heard the stories. It's happening out there. So with that, now I'm going to transition a little bit into the overall programming at Behavioral Health. So I talked a lot about the substance abuse services, some of the co-occurring recovery coaching. Just going to do a brief overview. We do have other services available for mental health. So mental health counseling, we have adult and child psychiatrists on staff, as well as 10 mental health therapists, 4 adult psychiatrists, 2 child psychiatrists, and 1 psychologist. We also have 5 social workers that are providing that coordinated service teams, which is a wraparound service for our youth. And we also have the Safe Care Pathways. So, right, September is Suicide Prevention Month as well as Recovery Month. The Safe Care Pathway is really to keep people safe if they're having any kind of suicidal ideations or thoughts. And Safe Care Pathway is a pathway that has been put in place to provide that intensive care to that individual. So we're seeing them, it can be 2 to 3 times a week. continuously providing support and getting them into other services to keep them safe and out of the hospital. And you can always walk into behavioral health services. We have 4 triage staff that are available. They're taking all of our phone calls. They're seeing the people that are walking in for substance abuse services. But you can also walk in if you're having a mental health issue. No, we are not a crisis center. However, we are part of the Oneida community and we're here to help you. So if there is something that is going on, please stop in. We're here for you. One of the last things that I just wanted to bring attention to is that the grief group has started, and it's a newer group that we had just started. It is on Thursdays from 4 to 6. If that is something that you're interested in participating in, please talk to your provider or call or talk to somebody in our triage office. That number is 920-490-3860. And for that, that's the good review of the overview of the behavioral health services. Now we're going to show just a quick little video about the fiscal year 24 year in review of behavioral health services. I hope you enjoyed the year in review for fiscal year 24. There's a lot of good services that we're providing within behavioral health, and if you are ever in need of services, we welcome you to join us. I wanted to just take a moment to thank all of you who attended the GUNIO event, I'm Healthy conference this year. We had about 300 people that participated in the event. It was a really nice event, really showcasing our recoveries and showing all of the good services that are being provided in the Oneida community, and really allowing our presenters to really engage with the community and show us other support services and resources available to them. Other things that I would like to just kind of do some reminders on is the same-day substance abuse care. There's no appointment needed for that, and we are located in the Gutnigulio Family Services Building, and the address there is the 2640 West Point Road, Green Bay. You just have to show up. Just show up before 10:30, and then we will be able to see you. We also have some other events that are coming up. I did talk about the opioid overdose awareness kits that are available. You could just walk into behavioral health at any time, and we have somebody available to go through the kit for you, take it with you. The idea is really to get the community all the resources that they need to save lives. We have a couple of other things. We have the Oneida Wellness Support Group. This is a group that is available Monday through Friday, 1 to 2:30. Again, that's at our main office, 2640 West Point Road. This is really about providing, you do not need a patient to attend the Wellness Support Group. This is really about providing support to those that might be having a little bit of stress, and it is a way to provide some coping skills for anybody who needs it. So just a reminder, you do not need to be a patient to participate in the Oneida Wellness Support Group. And then we have a couple of events that are coming up. We have the Oneida Recovery Nest 3rd anniversary event that is coming up September 22nd. That is 10 to 3. Come and join us. Get some food, talk to others, and get some resources, and watch the movie Ben is Back. And then we do have sobriety game nights that are on the last month of every month, which is from 5 to 8. So this has been going on for probably close to a year now. And it really is about providing a way for individuals to come together, do some things that is, while you're in recovery, that is fun, because recovery can be fun. And we really would like to welcome you in and have some fun with us, playing some games and having some laugh. And it is really good, sober fun. And of course, we always have the 3 numbers that are available to anybody who is in need, for if you are having some suicidal thoughts, to be dialing 988. That is the number that has been put in place for anybody who is having a suicide or any kind of crisis. It's a lifeline. If you're having any kind of medical emergencies, call 911. And the 211 is a number that is available for any community resources. So please take advantage of those if you do need them. And with that, I believe I am done. Thank you.
Wow, that's an amazing amount of information. Oneida Behavioral Health spans so far and is so broadly accessible to the Oneida Nation. Can you just remind us of your address, the location of the offices, and a main phone number?
Sure. Our main phone number is 920-490-3790. We're located at 2640 West Point Road in Green Bay. And then our recovery nest is at 1240 Packerland Drive, Green Bay. It's back by the cottages. And that number is 490-3950.
Wow, sounds like, everything you cover is based on lifetime behaviors that have been established either through your habits or, how you've been brought up and all these things. So there's so much there that you can access, and people are in great need. And every day we hear about the need, not just in Oneida, but every day, all the students, all the kids, all the high school, our elders, everybody. And it seems like we go from the cradle to the grave, and we help as many people as we can. Now, you did mention that these services, are they available to just enrolled Oneidas or federally recognized tribes?
So our eligibility for behavioral health is that we provide services to any Native American that's enrolled in a federally recognized tribe and their descendants. Now, we will provide some services to non-natives if they are caring for a Native child. And once that child is 18, then they do need to establish services for themselves. But if they are caring for a Native child, we will provide individual, couples, families therapy, anything. The whole idea is that we're providing services to the Native families.
And I see on your website that there's a media room.
Yeah,
A little
so
bit about that, a media room.
Yeah, the media room. So we've been working really hard on updating our website. So I really encourage all of you guys, everybody, to take some time to go check out the resources and things out there. And the media room is different articles or different videos that we've been putting in place, which you're going to hear from some of the providers. You're going to hear from some of our own community members talking about different services that they might have referred to or have participated in, and just different articles, a lot of education articles. I know we have some things out there about back to school, which is the thing that's going on right now. We're getting all of our young ones back in school, and there's just different things out there for coping on when life changes, seasons changing, different articles out there and education information. So I really encourage you to go check it out.
Right, thank you. There's so much out there. We hope you can come back more often. Certainly we have some openings in October and November, and we'll check out and see if you've got maybe some of the providers would be willing to come in and do a presentation as well.
Absolutely. We plan on doing that. We'll be offering a few more sessions just on specific services. I know today I gave you a lot of information, and with some of those additional services, we will have some of our leadership team coming in and talking about those specifically, so you know how to access those.
All right. Well, thank you again. And I do have a few announcements here. On Sunday, September 14th, we do have a General Tribal Council meeting that begins at 10 a.m. And there's one thing on the agenda, and that's to address the vacancy of the Vice Chairman's position. On Thursday, we have Oneida Business Committee Secretary Lisa Liggins, who's going to come in and do a review of that and tell you a little bit about the packet and some of the options that are available. And as usual, every Thursday is Farmers Market Day in Uptown Oneida. And this week, the Oneida Police Department will have their command center on site for people to view. They'll also have drones in the air. So come on out Thursday, Farmers Market, and check that out. We also have the Oneida Norbert Hill Center, the Norbert Hill Center parking lot will be under reconstruction. They're finally going to smooth out the bumps and put in some new parking lines, and that's going to begin next week, and that will be about a 6-week project. So if you have business at the Norbert Hill Center, please plan ahead. There may be a little extra walking, as parking is not going to be so readily available in the beginning. Watch for the signs. You may have to park over at the Turtle School or in the lower lots. There will be designated parking areas during this restructuring. Let's see. I think the only thing I have left is next week. As I said, Lisa Liggins will be here Thursday, and next week we will have Ryan Waterstreet from the Oneida Family Fitness Center talking about some of the updates over there and some of the changes. And also we're going to have Carol Stiff, manager of the Oneida Transit Department, and Carol's going to come in and talk a little bit about the transit program and some of the new things that they're experiencing at the new transit center. So other than that, is there anything we forgot?
I don't think so. Thank you for having me.
All right. With that, we'll see you on Thursday. Nugiwa.